Hello, everybody. This is Dr. Michael Beebe with Arete Chiropractic. And today on our collaborative business series, we're hosting Dr. Kate Wilson of Coastal Periodontics. Hi, Dr. Wilson.
Hi there, how are you?
I'm wonderful. Thank you so much for being willing to spend some time going over a conversation with us about what it is that you do in your practice. And then as we start to slowly reopen the Seacoast, exactly how you're keeping people safe and minimizing risk, and how Coastal Periodontics can be a resource for people in the community. So I'm excited to get into the conversation. Why don't you share us first, just introduce yourself and share a little bit about your practice and what exactly you guys do.
Good, so I'm Dr. Kate Wilson, as you mentioned, and I'm a periodontist. I practice right here in Portsmouth over on Pease. We've been at this location for about 5 years, and I've been practicing as a periodontist for about 10. I was a general dentist before that. Our practice is a dental specialty practice. It's a surgical specialty of dentistry. So we treat periodontal disease, which is gum disease. We do things like gum grafting for people that have gum recession. We do dental implants. We try to help patients with aesthetic concerns involving gum tissue. But I would say the most important thing that a periodontist does is to help patients to establish oral health and maintain that oral health.
Yeah, and that's so vital. And I have had a lot of dental work in my past personally, just because I had an accident in 2008 where I cracked my mandible and had some of my teeth come out, and they had to be put back in and all sorts of stuff. So you guys have literally saved my life personally, but I know a lot of people have relied on dental hygiene to not only make their teeth look pretty, but it's a lot more than just looking pretty. It's about making sure that the body can be healthy. And I have heard a lot about how oral health actually is a big indicator for your general body well-being. Is that true?
Without a doubt. There are incredible links that have been well established for years between the oral cavity and the rest of the body. Inflammation is really what gum disease is. And inflammation is a word that's become very important, or very, very commonly used today. I think it's drawn a lot of attention. And what people don't realize, I think, is that the inflammation that's in your mouth, around your teeth, we measure that, or we recognize that it's there by noticing bleeding. So if you brush your teeth and your gums bleed, or you floss and your gums bleed, that's inflammation. And that inflammation could be localized just around your teeth, or it could be very much linked to the rest of your body. Heart disease, lung disease, different types of cancers, autoimmune conditions. There are all kinds of different inflammatory diseases that can affect the body. And the oral cavity is often an area where it can be recognized first. And so the mouth is incredibly important to really, as an identifier for potentially other systemic problems, but then also to help prevent problems down the road.
Yeah, that's such an important part of the conversation. And so at my office, Arete, we also work with people who have chronic issues. So like you do, where if somebody has the need of a dental implant, that's an acute chronic thing that you can take care of, but also things that are preventative. And like you just mentioned, that preventative piece is so crucial. So, the top things that we see in our office are headaches, neck pain, and head and neck injury. And we specialize in the cranial cervical junction, or how that head and neck really influence the biomechanics, or the rest of the movement of the spine, all the way down to the sacrum and the lower back. And so we work with the health of the entire spine from the top down. And while we take care of chronic conditions, we also want to make sure that we're communicating a lot about the preventative aspects of health and wellness. When somebody comes into our office, we first just establish a health history. We just make sure that we know exactly what's been going on with respect to their spine, and make sure that they're a good candidate for the care. If they want to move forward, we get some 3D imaging of the head and neck, and then we move forward with a treatment protocol. And I imagine it's similar for you guys. So do you guys get typically referrals from general dentistry, or do patients come in themselves? Like, how does that work?
We do really have both of those things. Primarily, we have patients referred to us by their general dentist. So they're in for routine checkup with the hygienist and the dentist, and it's recognized that they may have inflammation present or sort of a new finding. And then they'll be referred to our office. Some patients are referred to us for very site-specific issues, like a single tooth that is cracked and needs to come out. Some patients are referred to us for a generalized problem, a chronic inflammatory problem. But when patients come in to see us, we spend quite a long time in our first visit just sort of assessing the situation. Even when a patient's referred to us for one thing, we still look around their whole mouth. Gives us sort of a baseline for where they are and a good understanding of their overall oral health. So we spend time doing a lot of measurements and sort of a fact finding. We look at radiographs, we take new radiographs if they're indicated. We have a 3D CT scan, much like yours, that we use as well to assess patients. And then once we've sort of established what their overall periodontal condition is, then we discuss with the patient the findings. We discuss options of what we can do to treat their condition. A lot of times there are options, so we like to make sure a patient feels very well informed so they can make the best decision for themselves. And then once we've established what the recommendations are, the treatment plan, we communicate with the general dentist. So when a patient comes to our office, we become part of their team. So we work hand in hand with the general dentist to help establish either stability or periodontal health. And then we tend to continue to work with that general dentistry office as part of the team to help the patient sort of achieve lifelong stability if possible.
Yeah, and the team approach to healthcare, I think it can't be understated how important it is to make sure that, you've got a good team taking care of your body. You obviously are kind of in the team of oral health. As chiropractors, we're in the team of spinal health. And, there's so many other things that we need to be aware of, whether that's, who you're, working out with, how you're moving your body, or what kind of nutrition you're taking in, or what kind of media and information you're thinking you're consuming. So you're taking care of your mental health, your physical health, your social health. All of these different aspects require a team.
Yeah.
And I love that you guys also have that 3D scan that we have in our office, because we actually stole the technology from the dental world.
Is that right? Yeah.
As chiropractors, that's where we got it. Yeah, and we just have now moved it into the chiropractic realm so that we can actually get that 3D visualization of the cranium and the cervical spine.
Yeah, it's phenomenal. Phenomenal.
Yeah, it's good technology.
Definitely.
And so now, Dr. Wilson, COVID-19 is on everybody's mind, and I know that dentistry did take a short break when we were on a stay-at-home order earlier in the year. But as we're slowly starting to reopen New Hampshire, talk with us about how you guys are changing protocols or keeping people as safe as possible to minimize risk.
Yeah, so we've definitely made changes to our office to really make sure that all of our patients and our staff and everybody's very safe. We were fortunate in that being a surgical specialty, a lot of the recommendations that the ADA has made and the New Hampshire Dental Society in terms of PPE, right? The things that we wear during procedures, a lot of that we wear already and have for years. Whereas maybe in an office where they're not doing surgery, maybe they didn't have those same requirements. What we've added to our office has a lot to do with patient flow. The numbers of patients that we have in the office at the same time. We're doing a lot of screening for every patient that comes into the office now is screened. We're screening patients when we call to confirm appointments. We're screening when they come into the office. We are limiting the number of patients that are in our waiting room. In our office, all of the operatories where we treat patients are all isolated, they're closed off. And so when a patient arrives and we screen them, we bring them right back to the treatment room. So most of our patients come in and out of the office and interact only with one or two staff members. They don't tend to even really see or really interact at all with other patients. We have added things like, instead of the regular level 3 surgical masks, we're also wearing respirators. We've got an air purifying system in the office now to help clean the air when we're in and not in the office. So we've taken a lot of measures. During the entire 6-week break that we were out of the office, or 7 weeks, we were really working on getting all that PPE. So when the governor said it was time to get back to slowly seeing patients, our staff was very well supplied, and we did a lot of training, actually, where we had the staff in the office and training and protocols to make sure that it all became the new normal for us. It's what we do now. And so we feel very good about having patients back in the office. We've had a lot of people in over the last couple of weeks that are so glad to be back to, because they know that without treatment, they're running a risk of their mouths and their oral health suffering.
Yeah, that, I mean, it sounds really comprehensive, what you guys have done. And I definitely think that being already a surgical office, you're a step ahead of the game anyhow. So sounds really safe and available for people, which is so important that you guys can be there for the patients that need the care. And
yeah, and everybody that comes into the office now has a mask on. We've always worn dental masks, and I feel like everybody's kind of experiencing what we've always experienced. You know, every patient comes in and has a mask on, and yeah, it's good. We've got a lot of measures in place.
Yeah, and similar at Arete, you know, we're making sure that we're taking our staff temperatures every morning, monitoring our personal health closely, monitoring our patients' health closely. We've significantly changed our patient flow as well. So spacing out chairs in the reception area, limiting the number of people in the office at a time, even offering people to wait in their vehicles if they would like, and then be called directly into our treatment rooms. We have private treatment rooms where it's just, you know, the patient and the doctor. And we're also wiping all touch surfaces down in between every person. After getting an upper cervical adjustment, we have people rest, where we take the weight of the head off the neck, so lie back in a recumbent position, which allows people to hold their adjustments and stabilize better. And so people are actually able to do that in their vehicles if they choose, just kind of lay the seat back to help their body stabilize, but also, again, minimize risk. And then additionally, you know, if people are, because our office is not as quite as separate as a surgical dental office, so if people further have complications where they are taking care of somebody who's in a higher risk category, or they themselves are a high risk category, we also have special populations appointments where we further limit the number of people in the office to, again, minimize as much risk as possible. So I think a lot of the offices in the Seacoast are trying their best to take care of their patient populations and to take care of themselves. And, you know, our ultimate vision is to really have the Seacoast get back to using the health resources that are not only going to help them feel better, but be very preventative to help their body's resilience. So, you know, you touched on preventative care and how oral health is a good indicator of your body's well-being. You know, spinal health is a big indicator of that, looking at people's postures. You know, when people are standing up straighter, they have greater lung capacity. You know, making sure that they have full air capacity is massive for decreasing toxification in the body. Making sure that the spinal joints are moving correctly decreases pain, which allows people to be more active, which allows people to actually have better metabolism, which stimulates when the metabolism is high, it actually stimulates the immune function. So all of these different things are just preventative aspects to limit some of these comorbidities that people are facing and can be challenging with COVID.
Yeah, absolutely.
Yeah. So I really thank you for taking your time to share with us this afternoon, and I'm really glad that you're able to be there for your patients.
Yeah, well, thank you very much. I appreciate it.
Yeah, you're very welcome, Kate. Have a good day.
Okay, you too. Bye.